Today we're going to talk about how to choose the right over-the-counter pain patches. Almost all of the over-the-counter pain patches are not FDA approved. So what does this mean? In simple terms, it means the FDA hasn't reviewed the product and thus hasn't approved it. However, the product may be marketed if it complies with regulations and policies. It's important to understand that those patches and how they work. These pain patches are also called dermal patches and transdermal plaster. A transdermal plaster or patch is a patch that after the backing is removed, it is applied over the painful area and then the medication is absorbed through the skin. Make sure you read the directions before applying and verifying that there's no contraindications or health complications you may have with the ingredients. Most patches should be left in place for up to 8 hours or unless specified. Now, if you're still in pain after the patch has been removed, another patch can be applied. But be aware that skin irritation is very possible and can occur with prolonged use if the patch is applied in the same spot. As with any other over-the-counter transdermal patches that does not require a prescription, it's not entirely safe for everyone. So it's important to read the label before using the product, and if you need to have a conversation with your healthcare provider. Your medical history may indicate that these patches are not appropriate for you. So it's best to check and make sure that you don't have any allergies, irritants, or contraindications with any of the ingredients within the pain patches. So let's take a moment and step back and talk about pain. Pain is a complex system that affects every person differently. So therapy should be tailored to each person's need because pain is multifaceted. It may affect several facets in your life, including cognitive, emotional, and as well as physical functions. The pharmacy shelves are lined with a host of transdermal patches, so the selection of your product may be overwhelming. Many people have a hard time figuring out what's best for them. So the pharmacist or doctor may also help guide you with the appropriate patch for what you may need. So how do these pain patches work? Well, it really depends on the type of pain patch you choose. It may reflect the ingredient that helps relieve the discomfort. So I'm going to describe some of the common ingredients that are found within these over-the-counter transdermal patches. You may notice that some of the patches may include one or a combination of ingredients. So the first one we're going to talk about is menthol. Menthol is a natural product from the peppermint plant, and it has a very cooling effect when applied on the skin. Menthol is known to increase the cutaneous blood flow. So it's great for when you need some extra blood flow into an area of your body and also while relieving pain. Camphor is also a way to ease muscle and joint aches. It's great for pain that's associated with bruising as well as superficial. So it too has a cooling effect, but is not very effective for thick tissued areas. Now, commonly menthol and camphor-based products are known as counter-irritants. That means they create a sensation that the body focuses on as opposed to the original pain, such as a cooling and warming sensation. These are seen in products like Bengay and Icy Hot. Lidocaine is another common product used, or I should say ingredient. Lidocaine is a local anesthetic that acts by blocking and interrupting of the transmission of pain signals. So it's best to relieve nerve pain. Now, there are a lot of different types of lidocaine out there, but one of the over-counter strongest strength is 4%, and that you don't need a prescription for. And lidocaine can help numb the tissue in a specific area and help reduce symptoms, including burning and stabbing and achy pains. Capsaicin, or also known as capsaicin extract, it's a resin derived from the red hot chili peppers of the capsaicin family. It has a warming to hot effect, and it helps block the pain messages to your nerve. Now, the over-the-counter capsaicin is used again to relieve minor pains in muscles and joints caused by like arthritis, backaches, muscle strains, bruises, cramps, and sprains. It helps with fibromyalgia, and it's even known to help relieve headaches and migraines. Now, there's prescription strength capsaicin patches, which are used to relieve pain of like neurological, burning, stabbing aches that last for months or years after the attack of a shingles. And also, prescription capsaicin patches are used in diabetic neuropathy. That's where you feel like that numbness and tingling due to nerve damage. Research also shows that applying capsaicin plasters or patches to specific acupoints on the body can reduce and prevent nausea. Now, I might butcher this word. Methylsalicylate is also referred to as sweet birch oil, tea berry oil, mountain tea, and there's other different types of oils it may refer to. But medically, it's been used as an analgesic, an anti-inflammatory agent, a counter-irritant, as well as a fragrance in health and beauty products. And it's a penetration enhancer for other topical medication. It's used to treat aches, pains of the muscles and joints, such as arthritis, backaches, and strains. And menthol as well as methylsalicylate work together by causing the skin to feel cool and warm. Again, it is a counter-irritant due to the cooling and warming effect. So when using pain patches, it's recommended to avoid heat in the area. Do not apply to skin that's injured or irritated, such as like cuts, scrapes, sunburns, infections, rash. Do not bandage or tightly wrap the affected area. Doing so can increase the side effects, but you're allowed to cover it with loose clothing. Now, there are various products out there. Solon-Pass is one product name that I'm going to mention just because it is the only over-the-counter topically available patch that has been FDA approved for temporary relief to mild and moderate aches and pains of muscles and joints associated with arthritis, back pain, strains, bruises, and sprains. Now, Solon-Pass is also considered a methylsalicylate or capsaicin patch. The other products available over the counter that temporarily bring relief by giving distraction to the pain with that cooling and warming effect. And I'm only going to just name a few. Tiger Balm, Icy Hot, Bengay, as well as other products out there that are similar with the counter irritants, but they're herbal based. And just to name two of them, the 701 medicated plaster. This is great for minor aches and pains of joints and muscles. And the Wu Yang brand pain relieving medication plaster. And this one's actually kind of interesting just because it provides relief again to aches and pains and joints. But the recipe is used by martial artist practitioners to help them recover from injuries that they had occurred during practice sessions. Lastly, I'm going to briefly just talk about prescription-based, which mostly are FDA approved. These are narcotics or opioid-based. They're usually prescribed for people who are in severe pain and who are expected to be needing pain medication around the clock for a long time. This prescription-based patches are used for those who can't also be treated with medications. So the question I get a lot is, which one should I use? That really depends on the pain you experience and its severity, as well as if it's an injury-based, nerve-based, or chronic. There are so many different types out there that there's going to be a little bit of trial and error on which will work for you, because not all pain is the same for everyone, and some people have preferences that can help determine which one they really enjoy. Some patches have odor that can be pleasant or off-putting, like camphor or menthol. And some patches you can cut to size, while others you can't due to medication, the gel, or other ingredients that can ooze out. So make sure you read the label. I enjoy patches that can cut to size so that I can use only what I need and it fits appropriately to the area. I also prefer lidocaine patches and capsaicin patches for nerve pain related with muscle spasms. In the past, It had helped me with relieving pain and reduced the pain when I had that herniated cervical disc. And I also used the lidocaine mostly when I went to bed. I prefer capsaicin patches when experiencing deep muscle pain and aches, and I use capsaicin for the heat to increase circulation. It's also very good to use on those very cold, achy days. And then I prefer the methyl salicylate, if I could pronounce that right, sorry if I'm butchering it, based on patches like Solonpass, patches for deep aches and pains along with inflammation. So I hope with this you get a better understanding of types of pain patches that are out there, and you'll find the appropriate one for you and with your pain management. May you find relief when you use these pain patches.